10 years ago, Singapore faced our first major health crisis as an independent nation, when SARS, or Severe Acute Respiratory Syndrome, broke out in March 2003. The outbreak dealt a significant blow to our economy and severely affected our community and our social life. Singaporeans rallied together during this trying time, and we emerged stronger from the experience. Madam, we will be holding a series of commemorative events later in the year. Mr. Fu asked about Courage Fund. We will also be reviewing the use of Courage Fund to make it more effective in helping our healthcare workers. I would like to take this opportunity to pay tribute and to recognize the contributions and sacrifices of everyone who was involved, in particular my colleagues in the healthcare sector, some of whom fell ill and some lost their lives as they care for their patients. We will and we must remember them. Madam, over the years, our healthcare system has grown from strength to strength, achieving good outcomes and delivering good care for our people. The Global Burden of Disease Study 2010 ranked Singapore men and women as having the second and the fourth highest healthy life expectancy at birth in the world. We were also very happy to find out last year that Bloomberg ranked Singapore the world's healthiest country. Premature deaths from cancer, heart disease, and stroke have also steadily fallen over the years. However, it is not time to celebrate yet, as there remain key challenges ahead of us, which my colleagues and I will be talking about. Our national health expenditure in 2011 amounted to 4% of gross domestic product. It is lower than the OECD's average of 9.5%. But we must bear in mind that several OECD countries have older populations than we do, and our expenditure on healthcare is likely to grow as our population ages. Aging will be a key driver of demand for healthcare services. An older population means a higher incidence of admission to hospital, and for each admission, a longer stay. Lifestyle changes are another driver. Many of us have sedentary lifestyles and do not exercise enough. More young people are taking up smoking and becoming obese. Non-communicable diseases, especially cancer, heart disease, and stroke, account for 60% of deaths in Singapore each year. Therefore, I agree with Mr. Lawrence Lien that we need to do more and be more innovative to keep Singaporeans healthy. Last year, I announced my ministry's Healthcare 2020 Master Plan to build an inclusive healthcare system for the future, one that will provide Singaporeans with affordable, effective, and good quality healthcare. Dr. Lam Pin Min asked about the progress of Healthcare 2020. First, on capacity to meet the needs of our patients. Over the past 5 years, resident bed days rose by about 4% each year, from roughly 1.5 million to 1.8 million bed days in total. A significant proportion of this increase was contributed by an aging population. Over the years, foreign visitors have remained about 2% of the public sector's total patient load, a question that Mr. Lau asked. Our hospitals adopt various strategies to actively manage the increasing patient load. For example, they deploy inpatient medical teams to the emergency department to ensure that prompt medical assessment and definitive care can be provided at the ED even before patients are warded. In the short term, we will increase our capacity by adding beds in existing facilities. NUH's current renovation project will make available an additional 79 beds by December. Ang Mo Kio Tai Hwa Kwan Community Hospital has just added 50 beds, and St. Luke's will add a similar number by year end. We will also be opening 2 new facilities this year. The new medical center at the NUH will open by July 2013. This will allow NUH to expand its specialist outpatient clinics and the day surgery operating theatres. The building will also house the National University Cancer Institute. The new National Heart Centre, on the other hand, will allow for expansion in our cardiac services. We are on track with our infrastructure plans for the medium term. The Ng Teng Fong General Hospital will begin to serve patients from end 2014. Let me show you how the hospital looks like now. Madam, I wish I could build a hospital as fast as the video shows. This is our next upcoming acute hospital. Jurong and Yishun community hospitals will be ready by end 2015. Sengkang General and Community Hospitals are scheduled for completion by 2018. In the central region, Outram Community Hospital will be ready by 2020, and altogether we will add 4,100 more acute and community hospital beds. This is 400 more than what we announced in Healthcare 2020. Dr. Lily Neo talked about planning for our future healthcare needs. Beyond 2020, we are planning for new hospitals in new population centers and in areas where demand is likely to grow. We anticipate that we may need to build 4 more new acute hospitals between 2020 and 2030. We are currently studying regional demographic profiles to identify potential locations for these new hospitals, and we will review our infrastructure plans nearer 2020. Madam, we are also improving our delivery of primary care to Singaporeans, which Dr. Lam Pin Min asked about. As more Singaporeans develop chronic diseases, a good GP in the neighborhood who is familiar with our family's medical history will be well placed to advise us on how to manage our health. This is also a point raised by Mr. Lian as well. We have taken steps to make primary care more accessible and affordable for patients. We introduced the Community Health Assist Scheme, or CHAS, to help lower to middle-income patients receive subsidized treatment at GP clinics, as well as for dental care. We enhanced CHES significantly recently. More Singaporeans have benefited as a result, and the number of CHAS cardholders has grown from 35,000 to about 250,000 since we made these changes, more than a 7-fold increase. We will monitor the scheme for a while more before reviewing it again, but I note Dr. Lam's appeal to review the age criteria. Participating GPs can already refer CHAS patients to public sector specialist outpatient clinics at subsidized rates, as Ms. Tim Pei Ling and Mr. Loh Tia Kiang asked about. They do not need to visit a polyclinic anymore, so long as they are a CHAS patient. During the budget debate, Dr. Fatima Latif asked about the progress on community health centers, or CHCs, and the family medicine centers, FMCs. There is growing support from the GP community for the idea of CHCs, which provide allied health and other support services to GPs and patients. To provide more patients with convenient access to such support services, we will be setting up 3 more CHCs this year in addition to Tampines. The next CHC will be opened in mid-2013 in the Bedok area, while centers in Jurong East and Tiong Bahru will open by year-end. We will pilot 4 family medicine clinics, or FMCs, this year. This is a group practice managed by private GPs in collaboration with other healthcare professionals with the support of ancillary services. Here, patients will be looked after by a regular care team and will receive comprehensive care. Our first 4 FMCs in Clementi, Lakeside, Ang Mo Kio, and Bedok will come on stream later this year. We will continue to work with GPs to explore different models that will best suit their needs and those of their patients. We will also need to build more polyclinic capacity to meet the growing needs of our population. We have refurbished Geylang Polyclinic to increase its capacity and incorporate age-friendly features such as barrier-free access throughout its premises. Similar improvements are being made to Tampines Polyclinic, and we will also be redeveloping Ang Mo Kio and Bedok polyclinics. In regions where there may be gaps in coverage, building a new polyclinic will be necessary. I'm happy to let Mr. Cedric Foon know that we will be indeed constructing a new polyclinic in the Jurong West area near Pioneer. This new polyclinic, along with the new Punggol Polyclinic, which Ms. Penny Loh asked about, will open by 2017. I anticipate that we will need another 4 new polyclinics by 2020 and another 6 to 8 more polyclinics by 2030. All our polyclinics are equipped to handle basic emergencies, a point which Dr. Teo Pin raised. However, for serious emergencies, patients will be triaged and referred to the emergency departments of our public hospitals. Polyclinics continue to play an important role in our primary care sector. Our polyclinics, together with a wide network of GPs and CHAS, provide the public with good access to primary healthcare services. Mr. Loh Tia Kiang asked for an update on the regional health systems, or RHS. Developing the RHS is an ongoing effort, and I can share with members the example of Eastern Health Alliance, which Mr. Loh mentioned. It is a collaboration between HPB and the Eastern Community Health and Eastern Health Group on the Eastern Community Health Outreach Program, or in short, ECHO. This combines community-based screening with appropriate follow-up care, as well as lifestyle advice, such as diet plans and workshops to help patients control their chronic conditions, such as diabetes and high blood pressure. Strong and lasting RHS partnerships will take time to build. One of the lessons that we learned from this Eastern Alliance is that trust and understanding among providers from the various sectors, public, the private, as well as the community sector, are critical to forge strong partnership and deliver coordinated holistic care to our patients. While each region has its own unique needs and will therefore develop quite differently, I'm confident that we can share lessons from my experience in Eastern Health Alliance and forge strong partnerships in these other regions as well. Mr. Loh also asked about the progress of National Electronic Health Record, or NEHR. This is a multi-year, long-term project which aims to facilitate information flow to improve care delivery. The system has been rolled out to almost 5,000 clinical users in the public healthcare sector, including 8 hospitals, 6 specialty centers, and all our polyclinics. Access to NEHR has also been provided to the Agency for Integrated Care, some GPs, and long-term care providers, with more nursing homes to follow. To help our healthcare providers understand how to use the system, our teams conduct on-site training and provide comprehensive information packages to all clinical users. Providers can share information such as patient diagnosis, lab results, medication, and discharge summaries. We will next work towards enriching the system's functionalities, including case management and shared care plans. With information shared across providers, we will have a system that is better connected, better coordinated, and better able to provide good care to each and every patient. Let me update the House on our progress on initiatives under the Ministerial Committee on Aging to take care of our seniors. We have moved decisively to enhance the access and affordability of aged care. Last year, we announced that the government will invest $500 million to build 10 new nursing homes, 39 senior care centers, and 56 senior activity centers by 2016. Some of the new capacity is already on stream. This year, 3 existing nursing home providers will begin their operations at their new sites. Bright Hill Evergreen and Singapore Christian Home are slated to start within the first quarter of this year, followed by Villa Francis. By the end of 2013, we will add more than 500 new beds to our nursing home capacity. 3 senior care centers providing day rehab and day care will also open this year. We have raised the subsidies for community hospitals, nursing homes, center-based care, and home care last year. Let me also clarify a point raised by Mr. Gerald Giam. We have simplified the means testing process and criteria in the ILTC sector to reduce hassle to patients and their families. They only need to give consent for us to access the CPF or IRAS data for us to carry out the means testing, as Mr. Ngiam suggested in his speech. In fact, we are already doing so. This has been implemented, in fact, since last year. One beneficiary of our subsidy enhancement was Mr. Tan Cheng Lim, who needed rehabilitation for his spinal cord injury. Mr. Tan also has other chronic conditions, including high blood pressure. With the changes to our subsidies, Mr. Tan now receives an 80% subsidy as compared to 50% previously at St. Andrew's Community Hospital's Day Rehab Center. Mr. Tan is happy to have his total healthcare bill reduced. This year, we will pay greater attention on 2 areas. First, enhancing the quality of aged care. We have started work groups comprising service providers as well as relevant agencies to look at care standards in nursing homes and center-based care. The nursing home work group has proposed a new set of guidelines and standards, and we will be launching an industry consultation on this shortly. Dr. Amy Kaur will provide more details later. Second, we will enhance the access and affordability of services to help the elderly be cared for in their own homes and in the community. We are making significant efforts to expand our home nursing, home medical, and en-suite home personal care services. Ministry of Health will convene an industry-led committee comprising professionals and home care providers to develop the home care sector, to chart new directions, new strategy, and set new standards to develop the home care sector so that home care can provide a viable alternative to nursing home. To make care more affordable, DPM has announced that the Seniors Mobility and Enabling Fund will be expanded from $10 million to $50 million to subsidize more devices and consumables needed by frail seniors. We will also provide transport subsidies to a wider population of wheelchair ambulance seniors who need to travel to day centers to receive care. Dr. Amy Kaur will also provide more details on this in her speech. Madam Chairman, seniors who need care often have complex care needs spanning social, medical, and sometimes financial needs. In order to provide more holistic and person-centric care to our seniors, we will merge the aged care functions of the Centre for Enabled Living with those of the Agency for Integrated Care under one roof, the AIC. Let me now move on to talk about how we are developing our healthcare workforce. In the past year, our healthcare professional workforce grew by 3,700, or about 8%. We are on track to growing our professional workforce to meet the healthcare needs of our population as outlined in Healthcare 2020. Our priority continues to be to grow our local healthcare manpower supply. We will continue to invest in the training of our healthcare professionals. In addition to classroom training within educational institutions, healthcare professionals also undergo supervised training in the public healthcare institutions. We also aim to raise the attractiveness of careers in healthcare. Last year, we increased the salaries for all healthcare staff in both the public and VWO long-term care sectors. This includes specialists, which Mr. Loh Tia Kang asked about. The salaries of our specialists take into account their contributions in all areas: patient care, education, research, and leadership. Their skills are especially valuable in our public hospitals where patients are cared for by a team. We need experienced specialists to supervise and lead the team and ensure that we deliver good quality care. We allow our specialists to see private patients, but within certain guidelines, as this helps to retain them within the public sector. We will be introducing a new remuneration framework in 2014, and we intend to pool part of the professional fees, a point that was made by Mr. Loh. MOH has also started a campaign to increase the awareness of the diverse and fulfilling work that nurses and allied health professionals do to attract more Singaporeans to join the healthcare. Beyond our local training pipelines, we will continue to supplement our healthcare workforce with overseas trained professionals, especially overseas Singaporeans. The pre-employment grant for Singaporean medical and dental students studying overseas has proven to be successful, with 189 grants given out since 2010. Foreign healthcare workers also help us meet our healthcare service needs, add diversity to the sector, and help develop our capabilities in various clinical specialties. Public healthcare institutions have put in place various initiatives to help them adapt to our practices and working environment so that they can be effective members of our team in serving our patients. Madam Chairman, I have outlined MOH efforts to ensure that our healthcare system provides for the care needs of Singaporeans. But better healthcare is only part of our strategy. More importantly, we should all aim to achieve better health by living healthily. Aging need not be a burden if we stay healthy. Instead, aging can be fulfilling and meaningful. If we stay healthy as we age, we can continue to live good quality life and contribute positively to the society and to the family. Each of us is responsible for our own health. the first thing we need to tackle is our own behavior. And I agree with Dr. Lam that we should start as early as possible, targeting at our youth and young adults, so that healthy habits are inculcated early in life. Let me outline two key ideas. MOH and Health Promotion Board are looking into introducing a set of food advertising guidelines for children. There is growing evidence that advertising affects children's choice for food as well as their dietary habits. As such, we will strengthen the standards for advertising to children for food and drink products which are high in fat, sugar, and salt. We conducted a broad-based consultation process on this issue last year. Responses from the public were overwhelmingly supportive for restrictions on food advertising to children to be introduced. MOH and HPB, together with the Advertising Standards Authority of Singapore and Advisory Council to the Consumer Association of Singapore, will jointly work out the details for implementation to be announced later. Today, our smoking prevalence is relatively low at 14.3% compared to about 20% in New Zealand, 21% in UK, and even higher in some developed countries. But it is on the rise, especially among our young adults. Smoking prevalence among young adults aged 18 to 29 years has risen at a faster pace than that of the general population, from 12.3% in 2004 to 16.3% in 2010. An effective way of discouraging individuals from smoking or picking up smoking is through a ban on point-of-sale display. This means that when you go to the retail shops, they will not have these products on display. Customers will have to ask for tobacco products specifically. Vendors can store these products in areas that are not visible to the public, such as in closed drawers. In the coming months, MOH will seek the views of the public on the point-of-sale display ban. Finally, let me share with the House our broader vision for healthy living. We aim to catalyze a whole of Singapore effort in which healthy living becomes a shared vision. To lead this effort, we have formed a Healthy Living Master Plan Task Force chaired by Parliamentary Secretary Associate Professor Muhammad Faisal Ibrahim. This task force will develop a plan on how we can change our current landscape to encourage healthier living. But such change must come from within. We want this plan to be created and owned by the people and to enable Singaporeans to make decisions for themselves that favor healthier living. The task force has done a lot of preliminary work and developed a 3P approach: place, people, and price. And it will consult extensively before finalizing its recommendations. Madam Chairman, I've outlined the progress on the Healthcare 2020 Master Plan. We are on track to enhancing access to healthcare services. We are also making good headway in building up our capabilities to provide these vital services. I have laid out our vision for a healthier Singapore, one in which individuals, organizations, and the community must work together to change the way we think about health. The conversation on healthy living must go beyond the boundaries of the healthcare sector. We need a whole of Singapore approach in order to keep Singaporeans healthy and give them greater peace of mind. Several members, Dr. Lam, Mr. Lim Biao Chuan, Ms. Jessica Tan, Ms. Janice Koh, Mrs. Lina Cham, have raised a concern shared by many Singaporeans, and that is how to keep healthcare affordable. How do we help Singaporeans pay for their healthcare costs? Today, we have a financing framework comprising 4 pillars: subsidies, MediSave, MediShield, and MediFund, what we usually call 3M, and subsidies. In 2002, we introduced ElderShield. Let me now explain briefly how all these work together to help our Singaporean patients. First, government subsidies. All Singaporeans can enjoy significant subsidies at our public healthcare institutions, up to 80% for inpatient care and 50% for specialist outpatient care, as well as up to 75% in our polyclinics. Let me give an illustration. Take for example, the median bill size for C-class wards at SGH, which is about 4,300 before subsidy. After subsidy, this is brought down to about $1,100. Patients can then use MediSave to cover up to the full amount of the balance, while MediShield helps Singaporeans cope with the larger bills. With MediShield and MediSave, for 8 out of 10 subsidized hospitalization bills, patients only need to pay $100 or less in cash. Those who still have difficulties after subsidies, MediShield and MediSave, they can tap on our MediFund. While our framework has served us well, we need to plan forward as our needs changes in years to come. I therefore initiated a major review of our financing framework last year. We have also held 2 sessions of our Singapore Conversation and engaged many Singaporeans, including patients, to hear their views. Let me elaborate on 4 areas of feedback that we have received. First, Singaporeans are concerned about rising healthcare costs. Today, we spend about 4% of our GDP on healthcare, or about $1,700 per person. This is similar to what Hong Kong spends. Over time, we can expect national healthcare expenditure to continue to rise as our population ages. So what drives healthcare costs? First, cost of the same treatment goes up over time due to rising costs of manpower, supplies, and so on. This is inflation. Next, as we age and our health deteriorates, we will spend more on healthcare. On average, annual expenditure on hospitalization after subsidy for a 65-year-old is 3 times that of a 45-year-old. The third reason, and a key one, is that healthcare is getting significantly better and more accessible. We have adopted more advanced medical treatments and technologies that achieve better outcomes for patients, and these have become more common than before. However, they are also more costly. For example, 10 years ago, a heart attack patient would have been given an injection to dissolve the clot in the heart arteries. Nowadays, it is standard practice for a similar patient to be treated with ballooning or angioplasty, which improves patient survival rates and long-term outcomes, but at twice the cost or more. A second concern of Singaporeans is with how much out-of-pocket cash we have to pay. Dr. Lily Neo and Dr. Lam have highlighted this. Expenses for outpatient care, including diagnostic tests such as MRI, ongoing medication, and long-term care, can become large cumulatively over time. Some Singaporeans have asked for more subsidies, especially in these areas, to further reduce their out-of-pocket bills. I will discuss our thinking in these areas later. A third area of concern arises when we hear stories of Singaporeans who incur exceptionally large healthcare bills and wonder, what if this happens to me? While such large bills may be rare in the subsidized public institutions, it is natural for us to worry about them. We need to provide Singaporeans with more assurance on this. We will carefully explore how we can provide Singaporeans with greater assurance against very large out-of-pocket payments, and we will take into consideration the various suggestions made by members. Finally, many Singaporeans have told us while there are many help schemes, they do not know how to get the help that they need. As Ms. Tan Su Shan mentioned in the budget debate, we need better outreach and communication to the public to reassure Singaporeans that help is available and that everyone will have access to good health care. I should add that it is not just the elderly who are concerned about the cost of health care, but also the sandwich generation, who are helping to pay for their elderly parents' health care and retirement needs while raising young families. While we want to encourage family support, there are limits to this approach, and Ms. Lina Cham raised this point. We need to calibrate our policies to ensure that reliance on future generation is within reasonable limits. We also want to help the middle income with the cost of health care, as Mr. Vikram Nair suggested in the budget debate. This is why many of our schemes, such as the CHAS for GP care, the Medication Assistance Fund, or MAF, for drugs, and subsidies for long-term care, have been extended to the middle income, and we will do more for this group. Madam, there is strong desire among Singaporeans for greater peace of mind, the assurance that I will be able to afford health care when family and I need it, whether now or when I grow old? We take these concerns to heart. We want Singaporeans to be confident that they can always afford the care that they need. Part of this involves managing costs in our system. We work with our hospitals to identify and introduce clinically proven and cost-effective treatments and provide sound advice to patients on the choice of treatment. This ensures good outcomes for patients at the most reasonable cost possible. To enhance productivity, we are making strong efforts to upskill our workers, leverage on technology and automation, and redesign jobs and work processes. Right-siting of care is also crucial in keeping our healthcare costs low. While we manage costs and ensure that we are effective in the way we deliver care, we also need to enable patients to pay for their portion of the cost. The subsidy and 3M framework has served us well so far, but we need to further strengthen this as the healthcare needs of our population evolve over time. The review of our healthcare financing system will be extensive and will involve fundamental shifts. Therefore, it will take more than a year to complete. Let me take this opportunity to share some of our initial thinking. Even as we seek to give Singaporeans greater assurance today, we must not inadvertently create a problem for future generations of Singaporeans. If we get it wrong, we leave a heavy burden of debt for our children and our grandchildren. This is why it's important to retain some key principles that have served us well. The starting point is for every Singaporean to take ownership of his health, to live healthily, seek treatment early, and make informed choices in seeking treatment. I was heartened that in our dialogues, including the OSC sessions, participants understood this well. For this reason, it is important to preserve the principle of co-payment, but we will also have to ensure that co-payment is affordable. With this in mind, let me elaborate on how we intend to shift the balance of the way we pay for healthcare. The first major shift is to increase government's share of national spending to provide Singaporeans with greater assurance that care will remain affordable and accessible. Government spending will not only rise in tandem with the increase in national healthcare spending, we will in fact take on a greater share of national spending from the current 1/3 to about 40% and possibly even further, depending on various factors such as demographics and our ability to manage healthcare costs and target our subsidies. This will help to reduce the impact of rising healthcare costs on Singaporeans, especially the lower to medium income Singaporeans. However, how we spend the additional money is also crucial. Today, the bulk of our subsidies go towards hospitals where the cost per episode is high. And as our population ages, delivery of healthcare will increasingly extend beyond hospitals. Many Singaporeans, including Dr. Chia Shi Lu, have given feedback on the cost of outpatient care. We have enhanced CHAS to make primary care at GP clinics more affordable and raised subsidies for drugs to help lower and middle-income patients. In our review, we will explore how we can provide more financial support in a targeted way for specialist outpatient care, primary care, preventive health care, dialysis, and long-term care to reduce the share the patients have to bear. The second major shift is on MediSave. We have been expanding MediSave use progressively since 2006 to include outpatient treatments for chronic diseases as well as selected vaccination and screening. Now Singaporeans can use up to $400 per MediSave account to pay for these each year. MediSave has been sized primarily to pay for subsidized care in the inpatient setting. As we grow old, we are more likely to require hospitalization, and each hospital stay is longer. If we allow unrestricted use of MediSave, many of our elderly may not have sufficient MediSave for their needs in the future. But I hear the concerns expressed by several MPs, and we do exercise flexibility on the ground for cases with exceptional circumstances. I believe if we calibrate carefully and put in place some safeguards, we can allow greater flexibility in the use of MediSave to reduce out-of-pocket costs without jeopardizing our future. We will review MediSave policies to see how to have greater flexibility in the use of MediSave We raised the cap on use of Medisave for chronic diseases from $300 to $400 last year. Can we raise it further? Should we extend chronic disease management program to include more diseases, as some MPs suggested? Or should we allow Medisave to be used for outpatient treatments beyond the CDMP? How do we prioritize the different needs to ensure that Medisave will not be depleted prematurely? How do we ensure that providers focus on the necessary and cost-effective treatments so that each Medisave dollar is well spent? These are issues that need to be addressed in the review. The government will continue to provide additional help for lower income and the elderly to save more through Medisave top-ups under the Workfare Income Supplement and the GST voucher for Medisave. In the budget, DPM Tharman announced higher WIS payouts for lower income workers and doubled the GST voucher Medisave payout this year for eligible elderly. In addition, $200 will be provided to all citizens 45 years old and above. We will study what else we can do to help Singaporeans build up their Medisave balances so that we can allow more Medisave to be used. The third shift is on the role of insurance. As Dr. Chia Shi Lu mentioned, we need to calibrate the balance between personal saving through Medisave and the role of MediShield by risk pooling. For us to stretch the health dollar and to give Singaporeans greater peace of mind, we need to enhance the role of insurance, such as MediShield and ElderShield. But we need to do this carefully to guard against over-servicing and overconsumption, both of which will lead to rising costs and higher premiums for all of us. We will study how we can shift the balance towards greater insurance coverage without driving up demand and consumption and allow insurance to carry a larger share of healthcare funding. Together with an enhanced government share I mentioned earlier, this can help to reduce the need for individuals to pay more from Medisave or cash. We recently enhanced MediShield to include congenital and neonatal conditions and gave each Singaporean baby a hongbao of $3,000 in his own Medisave account. This is a significant step towards making MediShield coverage universal for the younger generation. We will next need to look into how to help the older Singaporeans stay insured under the MediShield, a point which Dr. Livino raised. MediShield is designed to be a catastrophic insurance, primarily for larger inpatient bills. As we review how we can strengthen insurance coverage, we will also examine whether it should remain so, or if we can expand it so that it can offset a higher proportion of costs while keeping premiums affordable. We will also have to address Singaporeans' concerns about exceptionally large bills that go beyond the current cap of MediShield claims. Let me now turn to address the specific concerns of our elderly today. Budget 2013 will deliver an additional package of one-off Medisave top-ups for the elderly. But in addition to these ad hoc top-ups, we will need to review how best to support the healthcare needs of our elderly, especially the very old today. Many of these are our pioneers, and they may not have accumulated enough Medisave by the time they retired. We need to take care of their healthcare needs, and this is a priority area that we will be looking into in the review. Dr. Chia and Mr. Heng Chi Hao raised the issue of ElderShield. As the care needs of our seniors expand and become more complex over time, there is a need to revisit the coverage of ElderShield. We have started the review of ElderShield, but rather than to review ElderShield on its own, we really need a more fundamental review of the roles of government subsidies, insurance, and individual share of healthcare costs, and how aged care fits into this big picture. We will review ElderShield as part of the overall review of our financing framework. While we carry out this review, which will take some time, we will make a few immediate changes to strengthen our safety nets to keep healthcare affordable. First, on Medifund. Medifund plays an important role as a safety net to help provide peace of mind for both lower income patients as well as middle income patients with larger bills. We introduced Medifund Silver in 2007 to take care of our needy seniors, and we recently announced the establishment of Medifund Junior to help needy children. Ministry of Finance will be topping up the Medifund capital sum by $1 billion. This will increase the annual Medifund assistance by about 20% to $120 million to help more needy patients with their healthcare bills. We will use some of the additional Medifund monies to close existing gaps in Medifund coverage. Mr. Patrick Tay expressed concern about the high cost of dental treatment. From 1st April 2013, we will extend Medifund assistance to patients at the National Dental Centre. In addition, Singaporean mothers who face difficulty paying for their antenatal care and delivery can also be assisted by Medifund. By June 2013, we will also extend Medifund to the polyclinics, including dental services there. This will provide some relief for needy patients. We will continue to see how we can make our safety net more effective in giving Singaporeans greater assurance. Dr. Chia Shi Lu mentioned rare diseases. We will also explore how we can help this group. Next, on cost of drugs. The cost of drugs is also a concern for many Singaporeans. We provide subsidies through the Standard Drug List, or SDL, and the Medication Assistance Fund, MAF, to ensure that drugs are kept affordable for our subsidized patients. From 1st April this year, we will add 17 new drugs onto the SDL and MAF. These drugs include second-generation insulin products and insulin pen fills to help lower the cost of diabetic patients. I previously mentioned that atorvastatin, which is a drug for high cholesterol, was being reviewed. This drug will now be placed on the MAF. A patient who requires this drug to treat chronic high cholesterol can enjoy potential savings of up to $375 a year and pay just $125 instead of $500 a year for this drug, depending on its dosage and its subsidy level. These enhancements are estimated to cost the government $5 million a year. Finally, let me address a topic that many members have raised over the years, which was also raised by Ms. Tin Pei Ling and Dr. Lam Pin Min recently at this debate. Dr. Chia Shi Lu also asked about this just now. This refers to transaction charges for Medisave claims. This is a fee of $3 for each Medisave claim that patients make. As I explained last year in a PQ reply to Mr. Ong Teng Koon, this charge goes towards the cost of operating the Medisave scheme. However, I understand that this fee may pose a burden on patients, especially the lower income or those who need to use their Medisave frequently to pay for chronic disease treatment. My ministry has reviewed this, and I'm happy to let members know that with effect from 1st April, MOH will absorb these transaction fees fully. Madam, let me sum up. Over the years, we have established a healthcare financing system that has served us well. We have made changes to our financing policies and revise them regularly to respond to the needs of our patients and their families. Looking ahead, the landscape is shifting rapidly. Demographics are changing, and there is a need to strengthen our framework to give Singaporeans better peace of mind. There will be key shifts in government subsidies and the 3M framework. The review will take more than a year to complete, but I hope to be able to give the House an update and introduce some of the changes by the next COS. While everyone has to play his part to live a healthy life and to save ahead for its own future needs, the government will increase its funding share and put more money in prevention, primary care, and aged care. Insurance will be further expanded to enhance risk pooling across the population. Medifund, safety net will be strengthened and made more accessible. Ultimately, the purpose of this review is to give Singaporeans better health and greater peace of mind. Thank you.